So I like to think of breast surgery in two broad categories. Procedures that most folks are familiar with are called a lumpectomy and a mastectomy. So a lumpectomy is essentially breast conserving surgery. That means that we get to keep the majority of the breast tissue while we remove the cancer. A mastectomy is sort of the opposite, is removal of all of the breast tissue. And sometimes we can spare the skin or spare the nipple, or sometimes there can be reconstruction involved, but breast conserving surgery is essentially a lumpectomy. Another synonym for that is a partial mastectomy, meaning, again, removal of part of the breast. The reason why it's a good option for many women is from an oncologic standpoint, breast conserving surgery, when paired with radiation, gives equivalent outcomes to a mastectomy, which is obviously a much larger procedure, in terms of both recurrence, meaning the cancer coming back, and survival. Lumpectomy or breast conserving surgery is a smaller surgery, it's a same-day surgery, and from a cosmetic standpoint, it's usually very amenable. Doesn't require inpatient hospitalization, and the outcomes are really very, I think, cosmetically appealing to patients. I have found in my practice that most patients, unless it's necessary from a cancer standpoint, don't really prefer a mastectomy. Most women don't really want to lose their whole breast. The caveat with breast conserving surgery is that it does require radiation afterwards, whereas sometimes with a mastectomy it does not. One special thing that we do here at UH is Oncoplastic surgery. So for women who have a tumor that's a little bit borderline, or like I was saying, maybe their breast to tumor size ratio isn't that favorable, meaning their tumor is kind of large and their breast is kind of small, we can actually do some rearranging of the tissue afterwards in order to make it more cosmetically acceptable, even once we remove that tumor. And so I think nowadays with our surgical approaches, including hidden scar technology and oncoplastics, we can really provide a nice cosmetic outcome for folks while taking care of their cancer and maximizing the number of women who can have that breast conserving surgery. So when we detect cancers that are smaller and earlier stage, then we are much more likely to be able to perform a lumpectomy or a breast conserving surgery.